Good evening, and thank you for joining us for this virtual community town hall addressing the health of the Fredericksburg region. Throughout the pandemic, Mary Washington Healthcare leadership has been committed to keeping our community informed. As COVID-19 prevalence changes frequently, we know you have questions about the overall health of our community. Tonight, we're here to share what we know and how we're working to keep you and your family safe and healthy. During this town hall, you'll hear from our expert panelists, and we welcome you to ask questions in the chat during the conversation. Let's meet our panelists. First, we have Dr. Mike McDermott, Chief Executive Officer. We also have Dr. Christopher Newman, Chief Medical Officer and Chief Operating Officer. Dr. McDermott, at this time, I'll turn it over to you to start the program and tell our viewers the latest information regarding our region.
Thank you, Emily, and welcome everybody. Thanks for taking a few minutes out of your evening to join us so we can bring you up to date with what's happening here at Mary Washington Healthcare. We've been sharing with you throughout the COVID pandemic our experience and what we're seeing in our healthcare system here in the Fredericksburg region. And a lot has changed since we were last with you a little over a month ago. And so we'll start by showing the graphic that we like to show. It's the curves of our experience throughout the pandemic. Remember, on the left side of the graph, that's way back in March of 2020 when the pandemic started. And then all the way to the right side of the graph is today, and it's a timeline. In the yellow line on this graph, that's the number of inpatients that we've had in our hospitals at Mary Washington Hospital and Stafford Hospital combined every single day of the pandemic. And you can see last January, we had that large spike. As we entered the fall of 2021, we had the Delta wave that happened. And then a few weeks ago, we shared with you our experience really in the midst of the Omicron surge, where we had about 200 inpatients between Mary Washington Hospital and Stafford Hospital, really throwing our health system into what we considered crisis standards of care. And a lot has changed over the course of a month. Just as rapidly as we saw that increase in cases, we've seen a decline in cases, similar to the experience of hospitals and health systems throughout the country. And so that's good news. This Omicron surge really was like a flash flood. And as quickly as it came up on us, it seems to be receding. And so that is welcome news. And over the course of the past 4 weeks, we've seen a steep decline in our number of inpatients. We still have, relative to the history of the pandemic, 48 inpatients between Mary Washington Hospital and Stafford Hospital. That's a large amount as you look down that timeline. There's only really a few other points in time in the past 2 years where we've had that many inpatients, but really we're not at that crisis level of approximately a month ago where we had about 200 inpatients. And so that has caused a lot of relief in our system. And I'm happy to report to everybody that we are back to really care as usual. And I encourage everybody that we are staffed and safe, and you can receive high quality care with confidence at Mary Washington Hospital and Stafford Hospital. We are here for you, as our tagline would say. And so I also would like to note, it's one of the reasons why we're having this town hall and bringing everybody up to speed is we have seen a few patients come in recently with relatively more severe disease because they have delayed care slightly. And so I just encourage everybody, if you have healthcare needs that need to be addressed, don't delay care at this point in time. It is safe to come receive your care so that you can have a better health outcome. Okay, and that's really the message that I think Chris and I want to deliver to our community today is we have seen a steep decline in our inpatient hospitalized COVID patients, and that has allowed us to decompress as a health system and return to normal. And that is fantastic news. One of the other graphics we like to share with our community is our current COVID inpatients and their vaccination status. The yellow figures on the graph have always been those patients who have not received a COVID vaccine. The blue figures are those who are fully vaccinated, and the green figures, those up to date with a booster. And we do have some boosted patients that are hospitalized, largely those patients who are immunocompromised and cannot mount the appropriate immune response even to the vaccine. They've always been very highly susceptible throughout this pandemic. It's one of the reasons why all of us take extra precautions in the community to help protect those individuals that can't mount that immune response themselves. They need special protection. One thing in this graphic, and it's shown that we've shared these graphics several times a week, really, throughout the pandemic and through the Omicron surges. There's always a lot more yellow figures on the graphic than the other colors. And that's in stark contrast to the vaccination rates in the state of Virginia. I don't know if everybody's aware, but over 92% of adults 18 and older in Virginia have received at least one dose of the vaccine. About 82% of adults 18 and older are fully vaccinated. And so the graphics have never showed that there's disproportionate the impact that the unvaccinated have had and the hospitalization requirements for the unvaccinated. So I still encourage everybody in the community, if you've not been vaccinated, please get vaccinated. If you know friends or loved ones who are not vaccinated, encourage them to still get vaccinated. Booster penetration in the state of Virginia for those eligible is only in the 30% range. So a lot of adults who have been fully vaccinated have not taken advantage of the boosters, which we know have given some extra protection, especially during this Omicron surge. So again, if you are fully vaccinated but not boosted, I encourage everybody to get boosted as well to protect yourself.
That's great information, Dr. McDermott. Thank you for sharing. Those downward curves are very encouraging. Something that our audience may not know about, early in the pandemic, we actually formed an innovation council to help us find creative solutions to pandemic-specific problems like PPE shortages. And knowing that our staff can always use an extra set of hands, pandemic or not, the Innovation Council recently added a new member to the Mary Washington Healthcare family, and her name is Moxie. Now, Dr. Newman, for those in our audience who haven't seen or heard of Moxie, can you tell us a little bit about her role in the hospital?
Yeah, we're really excited to be one of the first health system on the East Coast to be implementing this new technology. Moxie is a point of service delivery robot. So they're not involved directly in patient care, but really they're involved in aiding our staff. So many of the nurses and our caregivers at the bedside very frequently have to leave the patients and go deliver something. That could be a lab specimen. They may have to go find a piece of medical equipment, medications, blood, many different times. And with the PPE they wear, they have to ungown, unmask, take the gloves off to leave the unit. So Moxie now will be doing all that delivering for us and allow our caregivers to stay at the bedside with the patients. And that's where they want to be and where they can best serve. So this is really, it's not replacing anybody on our Mary Washington healthcare team. This is just an added set of hands to help our teams.
Thank you, Dr. Newman. And a few of our followers out there have seen some pictures and videos of Moxie on our Facebook page, and they've had a lot of questions about Moxie and what her day-to-day looks like. So we've got a video to share with you to give you a little insight on how Moxie gets around Mary Washington Hospital.
Meet Moxie, a robotic hospital assistant. Moxie is a point-to-point delivery robot designed to help our care teams remain on their unit at the bedside instead of leaving to fulfill a medical supply or specimen need. Using Moxie is easy. Just visit the Moxie kiosk on your unit or department, and items you need delivered will be taken care of. Here's how it works. In this example, the pharmacy needs a prescription delivered to 4 West. Let's call Moxie to the pharmacy so we can give her the prescription. Select Moxie for delivery on the home screen. Under Order a Delivery to, select the unit or department you want Moxie to deliver to. Optionally, you can type in notes to describe the delivery or instructions to the unit or department the delivery is for. To complete the request, select Request Moxie. Multiple orders can be placed at one time by repeating the steps. You will see the deliveries in the queue. To cancel a delivery, just swipe left on the queued item and press Cancel. When Moxie arrives, the light on its head will glow purple with a message on the front screen, signaling it's ready to accept items. To continue the process, press the Continue button. Moxie has 3 drawers. Drawers that are available to be loaded will appear on the screen in blue. Select the drawer you want to open. You may also type in notes on the right-hand side of the screen. To proceed, close the notes, scan your badge, and the drawer will open. Once you have loaded your items, close the drawer and select Deliver Order and confirm. When Moxie arrives on a unit or department, you will see the purple light on the top and the front screen message indicating why it's there. Simply scan your badge and the drawer will open. Once you retrieve the delivery, close the drawer, and Moxie will proceed to the next task. If you want to request a delivery to your unit or department, call the department you need the item from and ask them to initiate a delivery with their Moxie kiosk.
Great, thank you. So now our audience can see how our associates use Moxie and how they may see Moxie if they ever visit the hospital. So Dr. Newman, moving on, we saw during the Omicron surge the need for really good, high quality masks. And many people in our community, especially those who are immune compromised or have a loved one who's immune compromised, they were asking us what kind of mask they should be wearing and how to identify an authentic quality mask. I know you recently made a video that we'll share here on Facebook, but for the benefit of our audience tonight, can you share some of the highlights from that video?
Absolutely. We're at a point where society is opening up. A lot of the restrictions and masking is going away. And for the vast majority of people in the country, that is probably okay. If you're up to date on your COVID vaccines and you don't have any significant medical problems, it is probably safe for us to start gathering and doing things again. But there are those of us that don't have that luxury. It's really 3 to 7% of the US population has an immunocompromised status. That could be anybody who is undergoing chemotherapy, who are on medications for autoimmune disease, folks who've had transplants, and many others. And the vaccines don't allow them to boost their immune system enough to maybe give them adequate protection. There may be others who are elderly, who have chronic medical conditions, and they also will need to protect themselves. So we talked a lot about cloth masks at the beginning of the pandemic, and that was really, there weren't readily available high quality masks, and it was for you to protect others from if you in case had COVID. But now we're at a point of the pandemic, and as society begins to open up, where people are going to have to assess their own individual personalized risk. And if you do fall in one of those risk categories, you have to protect yourself. So a cloth mask is not going to provide you adequate protection. It doesn't create the right filtration to protect you from Omicron or any other strain that we may have of COVID. So there's two important factors when choosing a mask, and that's the fit of the mask. It has to fit well. There can't be large gaps. And the other is the level of filtration. So that level of filtration, you often hear us talk about N95s. So N95 masks are masks that are generally worn by healthcare professionals taking care of patients with infectious diseases and problems. And they give very, very good protection from COVID. So that's one type of mask that we'll show. What's more readily available and actually a little more comfortable to wear when you're out and about would be the KN95s or the KF94 masks. And these are masks that are meeting a standard of China or Korea where they're manufactured, and they're not a US typically approved mask. But they provide a adequate level of filtration, and they also have a good fit, and they are more comfortable to wear. And that's what you'll find many people protecting themselves. However, there are a lot of counterfeits of these masks. So in the video, we will give some tips on how to spot a counterfeit and how to make sure that you're going to get a mask to protect yourself. Saw a question in the chat, Emily, about schools and masking. And both Dr. McDermott and myself throughout the pandemic have been very strong proponents of masking. It's been a very important tool to keep our community safe. But I think as we see this current wave going down, we're optimistic heading into the spring and this summer. And I do think it's time for us to start considering unmasking our children in schools safely. That being said, there may be some children who have some conditions, medical conditions that put them at higher risk, or they may live with a family member that is at higher risk. So those children should wear a high quality mask. Again, do not have them wear a cloth mask. They make pediatric and children KN95 masks, and that's what I would recommend in those specific cases. But for most children, it's a very low risk situation at this point, and we do need to take these opportunities when the COVID is lower prevalence to normalize a bit.
Thank you, Dr. Newman. I know there's been a lot of concerned parents out there wondering about masks for their kids. We do also have some questions out in the audience tonight about vaccines for kids. When might that be available, and how do kids not eligible for vaccination fare in this pandemic? Do you have anything to share with our audience?
Well, the very good news is that children under 5 are generally at very low risk unless there's a specific medical condition. And when we look at the risks and benefits, at this point, when it's been looked at thus far, that risk-benefit analysis has not felt to be valuable for children under 5 at this point. So we're continuing to watch that. We had felt that this spring we would have vaccinations for children in that age group. But at this point, the FDA, and I think this is really a testament to the FDA and how seriously they take this and approval of any medications or vaccines in the country. They're not just approving it to push some agenda. They are looking at the science very carefully, and this is a case where it's not felt to benefit children, this current vaccine at this point. So, but there'll be more information, and they're looking at it, and there may be vaccines for children in that age group coming forward in the future.
I agree with that, with the FDA. And I know there's lots of questions about, hey, when do I get my 4th shot and those sort of things. I think we need to follow the guidance as we continue to move through this pandemic, hopefully into an endemic sort of stage. And we'll have to follow. There are some recommendations for 4th shots for those immunocompromised individuals that benefit from that. But we're just going to have to follow the guidance as we continue to move forward. I know the CDC and the FDA are trying to follow the science as well as they can to make the best recommendations that they can for all of us.
Thank you. That's great information. I can see we have a lot of questions out here about those vaccines. We also have questions from folks about whether or not it's safe to travel and what precautions they should take if they plan to hit the road for business or vacation. Dr. Newman, do you have any guidance to share?
I'm always going to start with be up to date on your COVID vaccines. If you're eligible for a booster, get the booster. That's really going to be the strongest thing that you can protect yourself from hospitalization or a severe, outcome from COVID. After that, if you're on crowded spaces, if you are concerned about catching COVID, wear a mask. Otherwise, I do think things are going to be slowly opening up as the prevalence of COVID goes down at this period. We hope it lasts throughout the spring and the summer. Nobody has a crystal ball, but this is a point where if you are up to date on your vaccines and you don't have any serious health problems, that I think it is a time where we can consider traveling and getting back to some normal state of life for a while.
I know there's lots of questions about, well, when to wear and when do I need to wear a mask and those, and remember, in outdoor environments, the dissipation of virus in the air happens much better in outdoor environments, right? There's no doubt about that. Relative to indoor environments, the amount of ventilation is an important factor, the number of people in the room, and then the underlying prevalence of the vaccine in the community at any given point of time. That is always changing. And so the risk in all of those environments is always changing. And everybody just needs to be aware of how prevalent COVID currently is, and then and make sure that they're taking actions in response to that prevalence and in the environment that they find themselves in.
A little bit, and this is something that's been ongoing throughout the pandemic, is vaccine immunity versus quote unquote natural immunity. The truth is both do give you relative immunity, but unfortunately, that immunity does appear to wane over time. So, this is what we're beginning to follow. The safest thing is to get vaccinated. Don't try to get your immunity through getting sick. That is really rolling the dice and not a safe way to go. But we saw with Omicron, many individuals that have got COVID, for the second time, who had COVID previously in the pandemic. And we saw many vaccinated individuals get COVID. But the truth was those that did have some levels of immunity were less likely to end up severely ill, unless you had one of those immunocompromised statuses. But don't count on either. Unfortunately, the immunity does appear to wane to some extent, and we'll just have to follow the science over time. This is the bit of the uncertainty. And will there be a future booster? Will this be an annual vaccine? Who knows? But I would say one is not better than the other as far as the immunity goes, but you definitely don't want to roll the dice and get COVID to get your immunity. That's a very dangerous thing to do.
This also touches on the concept of herd immunity. I know there were some questions about that, and it's that's a complicated issue with viruses, because not every virus is the same as every other virus. There are different virus types, and those viruses have different tendencies towards antigenic drift and other sorts of things that make previous infection not like Chris just said. We know there are lots of people that have caught COVID multiple times and have been hospitalized. That natural immunity with a virus like a coronavirus isn't perfect, and neither is a vaccine. They provide protection, but they're not perfect, and you can have breakthrough infections. And so that concept of how close are we to herd immunity, very difficult to answer with a virus like a coronavirus that has the tendencies that it does.
Some questions here about KN95s and they're actually KF94s. So the answer is yes. Those are the preferable masks for most people to wear out in the community, or a very high quality surgical grade mask. And the video will go into more of that if you're interested, as well as tips on how to spot a counterfeit. Unfortunately, those masks are not produced in the United States, and there are some that are unfortunately passing off counterfeit masks to the United States. But we have some tricks so that you're getting a reputable mask to protect yourself. The answer is you should not be wearing cloth masks if you're concerned about protecting yourself, or low quality surgical masks, even the flimsy, some of the ones that don't fit well and are very thin. You really want to make sure you have a very high quality mask to protect yourself.
There's a question about our field hospital, and we did put it into use. I think when we talked to you about a month ago, we were talking about operationalizing that for monoclonal antibodies and some other care needs that we had when we were in the midst of that high point of the surge. But no, that's been ramped down, and we are not using the field hospital any longer for care at this current time.
One comment about a rumor on here, and we've dispelled that many, many times, about putting COVID on death certificates or on people's records to get paid more. Unfortunately, COVID has been devastating financially to health systems across the United States. It is not a moneymaker. In fact, it has been devastating truly to financial aspects, many financial aspects of healthcare systems. So that is absolutely untrue, and has no shred of evidence for that.
Yeah, the specific, a doctor does not get paid anything more for putting COVID on a death certificate. No,
not true.
Yeah, thank you. It seems like it's been a while since we've had an opportunity to debunk a rumor, so thank you for sharing that information.
A question about visitation, just also on COVID. So somebody is coming in for a procedure next week. The team is meeting again tomorrow to discuss whether it's safe to lift the visitation restrictions a bit. So we are following this very closely, and as the prevalence drops in our community, we are loosening some of the restrictions accordingly. But again, within the walls of our hospital, we take care of many sick individuals, immunocompromised individuals, and it is our responsibility to make sure everybody within the walls of our health system are safe, including our caregivers.
There's some questions about vaccine development, and hey, I heard this one's out there. It's going to protect against all SARS viruses and other sorts of things. And yeah, I've read a lot about lots of different vaccine types that are in development. Oral vaccines, nasal sprays, all sorts of different types of administration as well. And we'll just have to follow those they get tested to see how effective they are, and whether or not they can play roles and provide a broader sort of protection. It'd be great if they pan out to do that, but they need to be tested and approved for use. And let's, I know there are lots of scientists working on those things for us all.
Thank you. We do have another question coming up here in the chat regarding monoclonal antibodies. And if someone it needs that treatment or qualifies for it, how do they get it?
Yeah, so we do have a way, I believe, I'm not sure if it's through HealthLink, Emily. It was initially through the emergency department or other pathways, and our Safe at Home program that we're very proud about, that you can get the monoclonal antibody. But that has probably been one of the most effective treatments for COVID. It does have to be specific to the strain, and that is something we learned with Omicron. The initial monoclonal antibodies that we had early in the pandemic that worked so well were not effective against Omicron, and then we had a supply issue with the sotrovimab, which was the new monoclonal antibody. But we do have that available, and it's very, very important to get that treatment before you start getting very sick. So if you have high risk factors, you should get it as soon as you can after diagnosis, to prevent you from progressing in your illness and becoming severely ill. There are a couple oral medications that are now out for COVID as well. So there are starting to be some effective treatments. And so if you do get COVID and you are in a high risk factor, please seek the attention of a physician at Mary Washington. We can help you.
There's a question about our current positivity rate. I know, a few weeks ago when we were talking to you, it was up approaching 50% positivity rate. And we know the prevalence the positivity rate is not a perfect metric. It's one of the metrics we look at, because I know there was a point in time a month ago where it was very difficult to find a test, and a lot of people were symptomatic and had COVID and aren't reflected in that positivity rate. But it was approaching 50%. The current statewide level is 8.8%, and our Rappahannock Health District is a little higher than that at 10.6%. And so it is down significantly from where it was a month ago. Still, though, a positivity rate of 10% in our health district, we've always been concerned about. And so there's still coronavirus out there. I encourage you, if you are in those indoor environments or around lots of people, still protect yourself. I think that's a prudent thing to do currently with the current state of coronavirus.
Have some clarifications here on monoclonal antibody, just so I see several questions about how do you get it. So, most of the physicians in the region, as well as urgent cares, do know how to refer patients for monoclonal antibodies. So see your physician, go to urgent care. You can also do it through the emergency department, but you don't need to come to the emergency department unless you're severely ill. So I would go to your family physician or one of the urgent cares, and they should be able to direct you to us.
Thank you, Dr. Newman. We are at the top of our time for this evening, so I'll turn it back to our panelists to share some closing thoughts. Dr. McDermott, let's start with you.
Yeah, I would just, number one, I just want to thank our entire care team for everything that they navigated over the course of the past month. Really extraordinary circumstances on behalf of our community, really rising to the occasion for our community during what we consider to be a crisis here at Mary Washington Healthcare, and a healthcare crisis state of emergency here in our community. Happy that the current trend is receding and that we're back to care as normal. And my closing message to everybody who's listening today is just help us get that message out to everybody in the community that if you do have a healthcare need that needs to be addressed so you can have a good health outcome, please come and receive care. We're here for you. It's safe to receive care. We have capacity, and please don't delay care. Come receive care so you can have a good health outcome if you need it.
Thank you. And Dr. Newman, your closing thoughts.
Yeah, I would just want to echo Mike's gratitude for all of our associates at Mary Washington Healthcare. I mean, I think of the number of years I've been in healthcare, and I've never seen anything like this 1-2 punch of Delta into Omicron. But our care teams really stood by the community, worked against tremendous stress and odds, and stood in to care for our community. So just gratitude for them. And I also share a little bit of optimism. I'm hopeful that we all can have a little bit of normalcy as we head into the spring and into the summer.
Great. Well, thanks to both of you so much for sharing your time and your expertise tonight. And of course, a huge thank you goes out to you, our community, for tuning in to this broadcast. If you missed some of tonight's program, you can watch the full recording here on our Facebook page or on the Mary Washington Healthcare YouTube channel. And while you're on our YouTube channel, we encourage you to check out our other videos featuring the latest news and innovations at Mary Washington Healthcare. And of course, you can visit us online 24/7 at mwhc.com. Please stay safe and have a great night.